The Economic Update with Tatiana Bailey.
In today's economic update, when talking about the cost of care, we typically focus on children, but what about the challenges that come with elderly care? Well, right now, Dr. Tatiana Bailey joins us with a deeper dive into the struggles seniors and their loved ones face with getting support.
I've previously talked about caregiving for both children and the elderly, especially as it relates to the broader economy. For an upcoming panel on elder care, I've been digging in further, and I'd like to share some startling facts. Right now, about 7 in 10 Americans who reach age 65 will need some form of long-term care in their lifetime, meaning it's a reality most of us will face. The challenge is that the cost of that care often exceeds the total wealth many older adults have available to pay for it, even accounting for the fact that many older people sell their assets in order to pay for that care, particularly if they live past 75. And healthcare costs only continue to rise. At the same time, the system we've historically relied on is breaking down. People are living longer, families are smaller, and more women who have traditionally filled caregiver roles are in the workforce. Yet that informal system is doing most of the work, with 59 million Americans providing care to a loved one, contributing about 50 billion hours annually, mostly unpaid, and conservatively valued at $1 trillion per year. This actually exceeds total Medicaid spending in the U.S. Meanwhile, the formal care system is also under pressure. Medicaid now covers about 46% of long-term care costs, and even middle and upper income households often end up relying on it after exhausting their assets. High Medicaid spending is one of the reasons state budgets are increasingly strained. Currently, the U.S. has roughly 15,000 nursing homes, and there are quality concerns in many of them. About 43% of residents fall each year, with issues more acute for-profit, private equity-owned facilities. But there are alternatives. About 90% of seniors say they want to age in their own homes. When done safely, it improves health outcomes and reduces costs. Hospice and palliative care, often funded through Medicare, can also support families at lower costs. I'm privileged to be part of a panel this Saturday. It's a free event and details are on screen.